Welcome to State Scoop's Priorities Podcast. Every Wednesday, you'll get insights into the state and local government community, hear from top leaders, and learn about the latest news and trends across the industry. I'm your host, Sophia Foxoa. Here's what's happening this week. The Department of Homeland Security recently published a notice of funding opportunities for the fourth and final year of the state and local cybersecurity grant program. Among the details is a stipulation that grantees of the $1 billion program cannot spend their funds on services provided by the Multi-State Information Sharing and Analysis Center, a group that has shared critical cybersecurity intelligence, provided software and other resources for free or at heavily discounted rates for more than 20 years. As states conduct an additional round of bidding mandated by last month's changes to the Federal Broadband Equity, Access, and Deployment Program, initial data shows that SpaceX's Starlink and other low Earth orbit satellite internet providers are among the biggest bidders and stand to win millions over fiber optic cable providers. Illinois Governor J.B. Pritzker signed a law banning the use of artificial intelligence from providing mental health services, aiming to protect residents from potentially harmful advice. Known as the Wellness and Oversight for Psychological Resources Act, the law prohibits AI systems from delivering therapeutic treatment or making clinical decisions. Los Angeles County, one of the largest counties in the country, faces a homelessness crisis, with over 70,000 people experiencing homelessness, many of them children and families. However, for the second year in a row, the county saw a decrease in its homeless population. According to a recent report by the California Policy Lab, the decrease can partly be attributed to the Homelessness Prevention Unit, launched in 2021. The program uses a predictive model to proactively reach people at the highest risk of becoming homeless and connect them to stabilizing services before they lose their housing. Dana Vanderford, Associate Director of the Homelessness Prevention Unit, said the program uses 580 data points from various agencies to identify individuals at the greatest risk of losing housing within the next 12 months. Once enrolled, these individuals receive flexible financial assistance, links to supportive services, and consistent case management, with the goal of preventing homelessness and improving housing stability.
Tell me about the state of homelessness in Los Angeles.
Yeah. Los Angeles faces a crisis of unsheltered homelessness, with more than 70,000 people sleeping outside every night, according to our annual point-in-time count data. We are seeing some plateaus in that data in the last 2 years, which we're really excited about. But we certainly have, a crisis of people sleeping outside every night, and a lot of work to do in that arena to rehouse folks, provide them with wraparound services, get them back into permanent housing. But part of the problem that we also have to solve here is that we've got an inflow crisis. So as a community, we're housing more people than we ever have. But we have consistently seen that number go up year after year. So it means that there are people who are newly falling in to homelessness. So while there's a lot of work to do to rehouse folks, there's also a lot of work to do earlier upstream to prevent people from experiencing homelessness in the first place.
What do you attribute the uptick in people becoming homeless to?
Inflow can be a hard number to capture. So we don't know that there's an uptick necessarily in the amount of people falling in. We just know that there are, because we're rehousing so many folks year after year. But we see the number of people experiencing unsheltered homelessness remain the same or go up. So that means that there are new single adults, new families who are falling into that experience for the first time. I would say that our inflow crisis has a lot to do with a lack of affordable housing in this region. There are so many people who are one medical emergency or loss of a job, loss of a family member who they depend on for housing, away from, losing their housing altogether. So the margins are really slim. Everybody kind of is one crisis away from potentially falling into that disastrous experience when you live in a place where there is very little affordable housing available.
Yeah, I think that's a good reminder for everyone. You're using this term unsheltered. What is the difference between somebody who is experiencing unsheltered homelessness versus sheltered homelessness?
Yeah, we are lucky in Los Angeles to have a robust network of interim housing. Historically, could have been referred to as shelter. where somebody can exit, a situation where they're sleeping outside, come into interim housing, receive case management, hopefully receive housing navigation, and get into permanent housing ultimately. That can be a long road, as you can imagine. But there is a segment of people who are sleeping in interim housing every night, a temporary housing solution. There's a significant amount of people who are sleeping outside, not in any form of shelter or permanent housing.
I see. I see. Okay. Thank you so much for clarifying those definitions. Let's get into what the homeless prevention unit does, and is specifically using the predictive model to identify people who are at risk of becoming homeless.
Yeah. So the Homelessness Prevention Unit is almost 5 years old. I came over to stand this work up. Um, we were excited about an opportunity to really mount a novel approach to homelessness prevention. Several years ago, our partners at UCLA's California Policy Lab built and tested a model, a predictive model, ran it on County Info Hub data, which pulls in data from several county safety net systems. So, Department of Public Social Services, Department of Mental Health, Department of Health Services. Um, all of that data for LA County is linked. So you can build a model that runs on that data that can be predictive. So if you build and test this model, you can see what kind of interactions people are having the year prior to appearing in the homeless services system and kind of piece it together backwards. So UCLA embarked on this work, found out that we could, with a pretty high degree of certainty, effectively predict who is most likely to lose their housing and appear in the homeless services system a year from their point of prediction. The county, wasn't able to stand up a program to address that for a few years. But when they did, the work of the Homelessness Prevention Unit really began. So we still use that predictive model to identify our clients. That means on a quarterly basis, we get a list of high risk folks from our partners at CPL. It's then our job to do a little bit of eligibility screening at the front door. We're largely looking in administrative data systems to make sure that the person that we're looking at is not already experiencing homelessness, because they would not be a good fit for a prevention program at that point. If they're
Mhm.
not, then they're greenlit for our program. And that is when our proactive outreach begins. So we make 3 call attempts to every prospective client. We send letters to every address that we have on file. We send emails. We work really hard to try to get in touch with a population of people who are pretty hard to get in touch with and are not expecting our call, right? Our clients didn't raise their hand, so to speak, and ask to enroll in this program. So we are proactively identifying them and outreaching to them. Um, we've definitely gotten better over the years at getting our clients comfortable on the phone to the point where they'll say yes to enrolling in our program. We've learned a lot there. Um, so we're doing a lot better these days than we were in the early days of getting clients to a yes. And if they do say yes and enroll in our program, that's really where the HPU intervention begins.
I have so many follow-up questions.
Sure.
First off, because what you're describing is really reminiscent to me of what was it, the 1990s film Minority Report,
Funny.
except for predicting crime, it's predicting homelessness. So
Yeah.
before we get into once you identify an individual, I'm curious about the data that this model is
Mhm.
using. You mentioned that it pulls from a variety of agencies. Can you tell me more specifically what data it's using? Is it using income? Is it using housing security? Is it using food security? What specific data points allow you to identify somebody with such certainty?
Yeah. So the model has 580 factors. So it's a pretty complicated representation of a person's risk, and takes their holistic risk into consideration. So, it's actually not using eviction data to identify our clients. It's using things like emergency room visits, Department of Mental Health crisis stabilization holds, or 72-hour holds. Um, it's using arrests. It's using interactions with probation. It's using, a client's recent attempt to apply for new benefits. So it's these sort of like peripheral but crisis level and frequent interactions that somebody's having with the county that we think are clues to sort of broader instability, including potential instability in their housing.
Mm, okay. And so once you've identified somebody, you mentioned all of the steps in terms of outreach. Uh, you also mentioned that over the years, the unit has fine-tuned their ability to get somebody to say yes to enroll in this program. Tell me about that learning process and how you learned that along the way. And what are people most resistant to, your clients that you reach out to?
Yeah. Um, in the early days, we were losing close to 75% of our prospective clients due to lack of contactability, because clients would pick up the phone and think that we were a scam. Um, and Things got a lot better when we realized that we needed a dedicated team of people doing outreach for our program, that it wasn't something that a case manager could also do in addition to caring for their clients, that we really needed a team of experts to make these really challenging calls to highly acute clients who are very skeptical about this phone call that they're receiving out of the blue. So, in the recent update to the policy report that we just published, you'll see that one of our key takeaways was when we brought on a standalone outreach team, we saw a 67% increase in our enrollment numbers, which is incredible. It means less clients that we lose in that proactive outreach process. It means more people enrolling and getting the services that our program provides. Um, so we're really proud of that. And I would say, still, cold calling folks with complex health and mental health needs is really an art and not a science. And it is an extremely human process that requires a lot of patience, a lot of persistence, flexibility. There's a lot that goes into it, and our team has learned a lot.
Yeah, and I can imagine that some of these individuals that you're reaching out to not only have a healthy dose of skepticism about scammers, because that's obviously on the rise and everyone is looking out for that, but also maybe a little bit of skepticism about the government actually helping them, especially if they've had multiple interactions with county services, city services that have been less than positive or even less than helpful in getting them to where they are. So I can understand why there's a little bit of resistance there. How do you turn that around?
Yeah, it's tough. You know, our clients come into our program because they are touching all of these county services and systems, but just not in a way that really gets them what they need. So there's a very understandable mistrust of public systems, or that anybody from the county is calling with good news or to genuinely help you out. Um, so I think it just takes building rapport. I think it takes us reminding our clients that there's really no strings attached here. But for our most skeptical clients, like, sometimes we have to show up with our badge and say, like, I really am from the county's Department of Health Services. Sometimes we have to provide a gift card in those early conversations, so that a client realizes that we are here to quickly, immediately provide them with material assistance. And usually, like, if we can get that gift card in their hands, it allows them to buy groceries. Everything is like pretty smooth sailing from there because we have like shown up and did what we said we were going to do.
Mm. Okay, so you've identified an individual, you've gotten them to the point where they say, yes, I would like to be enrolled. I need the help. I can use the help. What is the next step? What are you doing?
Yeah, so the next step is assigning our clients to the case manager that they'll work with for the next 4 to 6 months. Um, We've got two teams that work with single adults, and we've got two teams of case managers that work with families. Each team has kind of particular expertise in serving those populations, which we think helps. Um, so clients meet their case manager, we do a warm handoff, we do an intake assessment where a case manager gets to know what the client's like needs and wants are. Um, and then the work really begins. So clients receive an intervention that has kind of three components. One is really flexible financial assistance. So with our program, every client receives a minimum of $4,000. Really to do whatever they need to do with it. It's not directly paid to our clients, So we pay out a landlord, we pay out a mechanic, we'll buy something directly for a client. We try our very best to honor our clients' needs here and let our clients really drive their spending, believing that they know best what would improve their housing stability. So there's the flexible financial assistance, there's the linkages to supportive services. So we really want clients to leave our program connected to a healthcare provider, connected to a mental health provider, or at least with those resources in hand for a time later when they might be more ready. We want folks to explore increasing their income with their case managers. We want to make sure that clients have resources on hand to improve their housing stability. So we make all of these connections to community-based resources that clients can stick with beyond their time with our program so that they're well held by systems of care. And then the third part is just really consistent, high quality, responsive case management. The money helps. The linkages certainly help, but our clients consistently report that the relationship that they had with their case manager, the effect that being like seen and heard really has on their life can totally turn things around for them. And so we keep our caseloads really low. We work really hard to keep our staff, retain our staff, keep our case managers happy and healthy with this team so that the case management component of our intervention is as consistent as possible. And we think that really has an effect on outcomes.
Yeah, I think it sounds like you're describing an entire ecosystem, like an entire symbiotic ecosystem that works together. Case managers need to have the bandwidth to give as much high quality attention as possible to these clients. These clients need to be like seen, supported, respected, and given a piece of autonomy instead of being, I don't know, reprimanded or saying, you should do this, you should,
Yeah.
allowing them to kind of steer the, like be in the driver's seat of where they're going and how they want to accomplish, like getting into a more stable future, whether that's housing, a job, healthcare, getting out of debt, and then going back around to making sure that relationship maintains and is continued. So it's really wonderful to hear that this is a data driven initiative, but it's really human centered.
Yes, that was really well reflected back. You kind of need each of those pieces to like make them all work, if that makes sense. Like our clients would not necessarily be open to, in a first or second or third conversation, talking about a serious mental health diagnosis. But at that point, we've like provided them with some financial relief. And we've like texted or called them every day just to see how they're doing. And so it really opens up um, space to have conversations about those deeper linkages and connections to care that we think are really critical to our clients sustaining their housing long term. But you need each piece for it to all kind of work together as effectively as possible.
Yeah, it sounds like it. And it also sounds like, I mean, homelessness is such a complex issue to try and solve, to try and prevent, that not only one factor will be the
Right.
determining one that
Yeah.
predicts somebody's homelessness or keeps them there. I'm also
Mhm.
curious for the predictive model, you mentioned, early on that it has a very accurate reading. I'm curious, has there ever been a like false prediction?
I'm sure there has, and there's some like questions about false negatives that CPL is honestly like the best entity to answer those questions. But we have tested our model. We believe that clients predicted by our model have 3 times more likelihood than the average county resident of falling into homelessness in the next 12 months. It doesn't mean that all of our clients are going to experience that outcome, but it means that some are. And that's really something that homelessness prevention programs in the past have not been able to confidently say. Um, Historically, and there's still a space, of course, for programs like this. In order to access a prevention program, you may need to have an eviction notice in hand, and you need to know what number to call or what door to walk through to access those resources. But you may not actually be a person who's going to experience this really severe adverse outcome of homelessness, you might be able to self-resolve. That's sort of something we haven't been able to see a more complete picture of in the past. But when you've got data like this and the ability to predict on that data, you can really capture risk in a totally different way and target resources more effectively.
Mm. Since the program and since the unit is seeing, such early success, do you think there's an opportunity or the potential to expand operations?
I really hope that we can pursue opportunities to expand in the next couple of years. Right now, we are still evaluating this work. We've grown. We're serving 700 clients a year, but we are not operating at a scale where we are going to have the impact on that inflow crisis that we really want and need to have. Um, I think there are real opportunities for expansion that I see right now. We're not working with youth, transitional age youth. So we're just working with single adults and families. Um, Tay require a really specific intervention, probably a longer time with our program. So we're very interested and we're talking to Tay providers, and we hope that is a population of folks that we can expand to serve. There is a real pipeline between Tay exiting institutions, foster care, incarceration, going straight into the experience of homelessness. And we would love to play a part in really breaking that cycle.
Hmm. And how else do you think the unit is, and this program specifically, is influencing any, I don't know, any long-term policy
Mm,
decisions by the county or even by the city or the state?
yeah. The HP was really the only program of this kind in the country. There have been efforts in the Bay, in Chicago, and New York to target homelessness prevention more accurately, but we are, kind of one step ahead there because of our ability to run this model on this robust linked data. Um, so I think we play a really potentially complementary role to referral-based prevention programs, those programs that I just described where I got an eviction notice, I can walk through the door of this program and get some financial assistance to resolve my arrears. We want to like stand side by side with a program like that. We're not serving the same people, but we can be complementary. And the third part that is really critical is specifically legal services for people facing evictions. I see this as the really healthy prevention ecosystem that could exist in Los Angeles County with the HPU, doing that predicting, doing that targeting with a really hands-on intervention that necessarily includes case management for the highest risk people. And then you get a kind of lower risk, broader programming that is that referral-based prevention, and then that top tier, that eviction defense programming. All three of those together, I think, have to exist if we are really going to tackle this inflow crisis.
Mm-hmm. Mm-hmm. What would you say to anyone that might be skeptical or critical of this predictive model on maybe an ethical basis
Yeah.
of taking somebody's data, using it to predict this very big crisis in their lives with the potential of getting it wrong or the potential for any type of bias in the model?
Yeah. It's an excellent question. We know that at its worst, AI predictive analytics can be used to inflict harm on communities. But when you're doing it right and you're thinking about equity at every stage of the process, and if you're measuring sort of your positive impact, keeping track of like any harm or lack of equity that might exist in your work, both in the model and in the program that you build on top of that model. I just think there's a lot of opportunity there, but we understand the dark side that could exist in this world where we can like predict outcomes of people's lives. We think that we are plugging in to people who, without our ability to proactively identify and outreach to them, would not otherwise connect to resources. In fact, we've got a pretty good idea about how infrequently our prospective clients are connecting to other prevention resources. If you look at sort of the universe of people served by if you look at the universe of people served historically by referral-based prevention programs and you compare that to our risk list and who shows up there, there's no overlap. So this means there's a very high risk group of people who are consistently experiencing that outcome, who are never connecting to the resources that have been available in Los Angeles. And you have to ask why that is. Is it the client's perception of risk? Is it their acuity that does not maybe allow for them to see that their housing is deteriorating around them? Is it their mistrust of systems that we deeply understand? Did they not know what number to call? Is it hard to navigate these systems? I think there's some truth to all of that. There's a real strong justification for a need for a program that is going to find those people who otherwise will not connect to resources and I think have a real likelihood of becoming chronically homeless because of their acuity.
You can subscribe to the Priorities Podcast at prioritiespodcast.com and wherever you get your podcast. While you're there, be sure to leave a review or a rating on the podcast page. That small extra step helps more people like you find the show. This podcast is a production of Scoop News Group in Washington, D.C. Adam Butler and Carlin Fisher help put it together. Until next week, I'm Sophia Foxowell. Thanks for listening.